Our next speaker is April Holman, who's the Executive Director of the Partnership for Early Success. The partnership is committed to providing Kansas children from birth to age 8 the best possible start in life. Before taking over leadership of the partnership, April spent most of a decade, almost a decade, at the Kansas Action for Children as Director of Policy and Research. And before that, she worked as a fiscal and research analyst at the Kansas Legislative Research Department. She's got a Bachelor in History and Political Science from Bethany College and a law degree from Washington University, excuse me, my alma mater. Welcome.
That's great. Thank you. I do not know how much I'm going to be able to cheer you up, but I'd like to talk to you a little bit about what's going on in the world of early childhood here in Kansas as it pertains to, in particular, funding. So if you would go to fine. The things that I'm going to go over are basically a background for those of you who might not be as familiar with our early childhood system, a background on the funding, the Children's Cabinet recommendations for next year, a looming crisis that's coming in early childhood funding through the CIF. I'm going to talk to you a little bit about what our response has been in creating the Partnership for Early Success in hopes of changing the situation that we have at hand, talk a little bit about the partnership's policy priorities for this year, and then I'm going to end up with a plug for an event that we have coming up in February. So, I think we're good. So just to start out, for those of you who aren't familiar, in Kansas, our system for funding early childhood care and education is primarily funded from tobacco dollars that have been paid to the state. So back in 1998, Kansas and a number of other states settled a lawsuit with tobacco companies, and it's called the Tobacco Master Settlement, so you'll hear that MSA dollars a lot in this context. And among the things that it did were to place restrictions on tobacco sales and advertising, and then provide payments to reimburse states for the cost of tobacco-related illness. In Kansas, lawmakers decided that the best way that they could help prevent new smokers from taking up that habit was by providing high-quality programs for children. And so the decision was made to put that money into a new system that would have an endowment called the Kansas Endowment for Youth. So all of the money that comes in from the tobacco settlement first goes to that endowment, and then each year a portion of that money that was in the endowment would then flow to the Children's Initiatives Fund to pay for, supposedly, for innovative programs for children. I say supposedly because the idea, and it's even in statute, was that those dollars would not be used to supplant state general fund dollars and investments that the state had already been making, but that unfortunately has not been the case. So there's the most noticeable program that was shifted from state general fund support to the CIF as parents as teachers. That had been in place for a long time in Kansas before this system was even created. And now they receive all of their funding from the state through the Children's Initiatives Fund. So the Children's Initiatives Fund is administered by the Kansas Children's Cabinet and Trust Fund, and they ensure that the accountability for evidence-based practices in the programs that receive funding, and they make a recommendation each year to the governor for annual CIF spending. And they also directly administer the Early Childhood Block Grant, which really does provide that innovative funding to help move the needle on programs that receive it. The ultimate level of CIF spending is determined through the appropriations process, through the legislature and the governor. CIF spending in the past 5 years has averaged about $55 million. Interestingly enough, though, that's not how much we've been receiving in the Kansas portion of tobacco settlement dollars. So each year for about the last 4 or 5 years, there has been an estimate of $55 million that the governor has based his budget on, and then it has turned out that the states received more than that, in some cases much more, as many as $68 million in a year. And so that leaves the whole difference very vulnerable. If that has not shown up in the governor's budget, it seems like it's just extra money that's not needed by the system. And in fact, last year there was an attempt to sweep that money, $5 million of that difference, into the state general fund to pay for economic development. And it was something that actually made it through the legislative process, but the governor used his line item veto to prevent that from happening. So for this year, the Kansas Children's Cabinet met last month, and they made their recommendations for funding. And actually, this was very exciting to us. For many, many years, the recommendations of the cabinet have been flat funding, which in an environment where there have been cuts that many programs have seen, and Annie certainly talked about this earlier, everyone was glad to at least hold the line with early childhood, but that's become more and more of a problem for those, you probably know this from firsthand experience, for those agencies that have received flat funding for a number of years. It's really difficult because costs have certainly gone up, and so you're really trying to do more with the same or less amount of money. So this year, the Children's Cabinet acknowledged that we have been receiving more like $62 million for the past couple of years, and so they budgeted all of that $62 million in their recommendation. So about $55.2 million is going to provide at least a flat level of funding for all programs receiving CIF dollars. And then they picked 3 programs that they thought particularly needed to see increases. And so that's the infant and toddler services, also known as Tiny K. They were recommended to receive an additional $3.4 million. Kansas Early Head Start was recommended to receive an additional $1.7 million. And the Early Childhood Block Grant was recommended to receive an additional $1.7 million with the idea that that money would be used to improve quality of care. There were a number of programs that were recommended to report back with changes that were made to reflect the new blueprint for early childhood structure that the Children's Cabinet is coming up with. And then the only other thing that I would highlight was the Parents as Teachers program was asked right now. That's a program that any child can, that any family can receive those services, and they're free of charge. But the Children's Cabinet, and there certainly have been a number of proposals by the governor over the years in his budget to make this a situation where there's a sliding scale. So for those families who can afford to pay for services, they would be required to do so. And the Children's Cabinet recommended that this year, that Parents as Teachers come up with a plan to put that in place. The looming crisis for the CIF is that there is a portion of those tobacco payments each year called the strategic contribution payment, and those are going away in 2017. So when they created the original settlement, there were 2 things. There's the base annual payment, and that's actually kind of, it's not a set amount. It depends on how much people are smoking in the state and a variety of kind of moving numbers. But then there's also the strategic contribution payment. That was set. So we know that that was going to happen from 2008 to 2017. And right now that represents about 24, you can go ahead and change the slide, about 24% of our payment each year. So it's a significant amount. We're talking about going down to the area of about $41 million a year in 2017 if once the strategic contribution payment goes away. So the reason I'm telling you about this is just that we need to kind of have in the back of our minds that we have issues to address, and we don't have a lot of time to do it. And so that's something that's coming up. So, what are we going to do about it? We have created a new coalition this year called the Partnership for Early Success. It takes the place of the Kansas Coalition for School Readiness that was really focused on children ages birth through 5. And our new partnership is focused on birth all the way through age 8, just acknowledging that there is a lot more similarity developmentally in children throughout that age span, and that there are many issues that probably make more sense to work on, like early literacy, that go all the way up through age 8. We're focusing also on the whole child, so where in the past we really had a very tight focus on early care and education, we also, with this new partnership, are thinking about health for young children and family supports. And we're also hoping to bring a broader range of voices to help strengthen our message, so including some partners that we have not had in the past, like the healthcare field and military. We've asked people to, organizations and individuals, to sign up so that we have a list of the members of our partnership. If you all are interested in doing that and you haven't had a chance, I brought some forms at the back of the room, and I would love it. It turns into a postcard, so you can take it with you and sign up, or you can leave it for me today. We have 25 official members right now, and you can see who those members are of the leadership team. We have a website, which is www.kansaspartnership.com, that you'll be able to find a lot of information about what's going on and the policies that we are working on. The policy priorities of the partnership this year, we have 3 of them, and there really is only one that's specifically geared towards the legislature, and then the other 2 tend to be more administrative policy priorities. So the first one is restoring the Children's Initiatives Fund. The CIF, like I said, there's been flat funding for a number of years. As a matter of fact, most programs that are supported by the CIF have not seen an increase in their funding since 2007. So that's a pretty significant amount of time. We know that inflation's not the best way to measure the types of things that programs are spending their money on, but even if we look at inflation as a measure, that's gone up 15% in those years, where programs are just really stuck with the same amount of funding. And so there have been a number of consequences of that. We did some research this fall with our partners just to see what that has meant for them to be stuck with that same amount of funding. And we found that most of them had had some sort of repercussion because of it, including staff and service reductions and waiting lists. So many programs either didn't have a waiting list in 2007 and they have since created them, or they had a waiting list, but it has expanded exponentially since 2007. So the first priority, again, like I said, was legislative, and it is supporting those increases that the Kansas Children's Cabinet recommended. The second is promoting early literacy. This is administrative in nature, and in fact, we hope that it's something that the Kansas Children's Cabinet will include in the Early Childhood Block Grant. But we know that reading proficiency in 3rd grade is a strong predictor of school success and the likelihood of high school graduation. We also know that professional development in literacy, funding for that is very scarce, both in the K-12 world and in the early childhood world. And we also know that the more we can get those 2 groups talking to each other at the local level, the better off the children will be that are transitioning from early childhood into the public schools. And so we want to encourage that collaboration at the local level. So the proposal is to create an incentive, an extra weighting in the Early Childhood Block Grant to encourage that collaboration and joint professional development. The third thing is improving child care assistance policy. Some of this is unfolding right now. The federal government just reauthorized last month the Child Care and Development Block Grant. That's a fantastic thing, and there are a number of new requirements that go with that. So we're sorting out what all needs to be done in Kansas. But again, if you look at our reimbursement rates for child care assistance in Kansas, those haven't been increased since 2002. And so there clearly is a problem, and it needs to be updated throughout the state. So we are hoping, we've already started initial conversations with the administration, but we hope to be able to work with the Department for Children and Families to make sure that as they reopen the child care assistance policy, which they have to do, we can get as many meaningful changes for Kansas families as possible. The plug was just a quick plug for the Symposium for Early Success. It's a new event that we're holding, a luncheon in February. We're bringing in Dr. Vincent Paletti, who's one of the co-authors of the Adverse Childhood Experiences, ACEs research, and we're thrilled to have him come in. We're really wanting to highlight the importance of the early years on later adult health at that event. And then we'd love it if you would, if you want more information, if you would stay informed by either going to our website, you can follow us on Twitter, and you're always welcome to contact me if you have questions.